Dear students, today we will discuss swelling in the proximal forearm for differential diagnosis. Before discussing that, we will go through the MCQs. So, what this procedure is, look at this, just see and see what exactly this procedure is, A, B, C, D. Find out the right answer, put it in the comment box. I appreciate your answer. Second MCQ is what this condition likely to be. Look at that right limb, there is so many things are there, dots, maybe pigmented also. See that edema is there. So, what is the right answer? A, B, C, D. Put the right answer. I appreciate your answer. And before going to the about the discussion of the case, I request you to join my YouTube channel, share with your friends and colleagues, press the bell, and learn surgery on day-to-day basis about X-rays, images, instruments, clinical cases, operative procedures, specimen, and so on, for brief 5 to 10 minutes lectures. So, the day-to-day you can enjoy the learning surgery easily, and also live sessions once in 2 to 3 weeks, where student will present a case. We'll have live sessions for 1.5 hours with faculties other than me, senior faculty will be there. So, a lot of interaction will be there. So, how to present a case, how to discuss a case, how to manage a case will be there in the live session. So, if you join live session, you will get a certificate also. So, please join live session, please subscribe my YouTube channel. So, we will go through the case. What is the differential diagnosis? You can see that there is a forearm, there is the elbow here, this is the forearm, there is a swelling here. So, the skin there is something, it is a well localized swelling. So, you have to find out the mobility, you have to find whether it is mobile in 2 direction or 1 direction. You have to contract the muscle underneath and again check the mobility. Skin pinchability, or probably skin is not free here, skin pinchability you have to check. Then warmness, tenderness, then surface, consistency, and fluctuation is there or not. If there is fluctuation, you check the transformation, and swellings in other parts of the body you have to check. And because it is in the upper limb, forearm, inguinal lymph, I am sorry, not inguinal, axillary lymph nodes has to be checked. So, drainage lymph nodes should be checked. Opposite side forearm, because maybe it is bilateral, especially adventitious bursae are bilateral. So, few other conditions also bilateral. So, anything unilateral, other opposite side should be examined. That is a basic clinical concept. So, opposite forearm also you have to examine. Other parts of the body also you have to examine. Many times bursae are multiple, lipomas are multiple, sebaceous cysts are multiple swellings in the body can happen. So, other swellings whether there or not, if they are present, that also has to be examined. So, distal part of the swelling also, pulse, wasting, movements of the joint distal to that, proximal to the movement of joint, all those things also has to be checked. Fixity also has to be checked. So, entire exam swelling should be done. So, we can always go through my clinical method in surgery swelling chapter, where live session is there with the QR code to examine out swelling, and also lot of photos, the differential diagnosis is there, so that you will understand exam swelling very well. And also my swelling chapter in the manual of surgery also very useful to learn surgery in the best way. So, what are the differential diagnoses you will think of? Lipoma, adventitious bursa, neurofibroma, soft tissue tumor, implantation dermoid, skin adnexal tumor. Additionally, simple sebaceous cyst also, sebaceous cyst or epidermal cyst, or Wen, W-E-N, it is also called as Wen. So, simple sebaceous cyst also can be a differential diagnosis here. So, accordingly you may have to do an ultrasound, sometimes MRI, and treatment is excision, because it is bigger area. If it is very freely mobile, you can remove it under local anesthesia. Otherwise, under brachial block or general anesthesia, you have to remove it and suture it. So, there is a treatment. So, differential diagnosis you have to remember is very important. Proper exam swelling is very crucial in all these patients. So, for detail about chapter, we can go through my manual of surgery and go through my clinical methods of surgery to learn swelling in a better way. So, quotation of the day is: growing is adding life to years, aging is adding years to life. Again, growing is more important than aging. Aging will happen to everybody, but growing parallel is also equally important. That's what exactly this quotation says. Again, request you to have my manual of surgery, which covers everything as per CBM syllabus, with the beautiful footnotes, with lot of photos, etiology, pathology, investigation, treatment concept, tables, charts, everything is there, and covers general surgery, endocrine surgery, thyroid, breast, vascular disease, venous disease, specialties, urology, neurosurgery, thoracic surgeries, GI surgery in detail, instruments, specimen, instruments, operative surgery, anesthesia, adjuvant therapy, and lot of photos and illustrations, and cover CBM syllabus entirely useful. Best book for UG and PG to learn surgery, and each chapter has got a online live session, online MCQs, which will be very useful to learn MCQs, and you will be able to face any exam in interventional surgery, general or competitive or NEET exam like. So it will be very useful. So have my manual of surgery, have my clinical method in surgery, which gives how to examine a patient from general examination to examination of the vascular disease, venous disease, thyroid, breast lump, endocrine, mass abdomen, rectal examination, urology, specialty examination, briefly orthopedic examination, with a lot of photos, methodical examination. Each chapter has got a QR code which shows the how to examine it for hernia or thyroid, how to examine thyroid, how to examine breast lump, how to examine hernia, hydrocele, and so on. This live 20 minutes videos will be very useful to learn examination properly, which is very crucial for facing the practical exam. And a different table with the differential in each chapter is very useful to recollect and remember the thing. But there are no investigations and treatment because it's a clinical book. So have my best clinical method of surgery, SRB clinical method of surgery, to learn clinical methods in a better way. So students, and also students, I request you to subscribe my YouTube channel, share with their friends and colleagues, press the bell, learn surgery on day-to-day, daily basis, and also join live session whenever it is there. So students, I hope you have understood this lecture very well. Thank you so much.